This is a gentleman that called into place an order for herbs. Would appreciate a video or topic in a video about prostate issues. If you have a prostate issue, and this also go to the females and have ovarian cysts or uterine fibroids or endometriosis or atypical cells, or we have prostatitis over here or prostate cancer, female cancers. These are all kidney problems. Why? Because the kidneys filter the sewage from the cells in the prostate, the cells in the ovaries, the cells, the vaginal wall, the cells that make up the uterus. The kidneys filtrate the acid waste from all parts of the human body, as well as the skin is another kidney of yours. This is why we talk about kidney filtration as being vital and key. If you're having a hard time, go on a little lemon fast. Go on a 10-day lemon fast. Pull the astringents into there. But I can say that when you're looking at kidney failure, you're looking at prostatitis. The prostate's just a gland. It's just a gland made of cells. And those cells depend upon being fed and depend upon being cleaned. Their waste removed from them. Just like the cells in the ovaries, the cells in the vaginal wall, the cells in the uterus, but also the cells in the liver, the cells in the bowel wall, the cells in the lung, the cells in the eye, everywhere has the same issue to deal with. That's why this is always a systemic problem. When you have prostatitis, believe this or not, you're having a systemic problem. And that's why you have to address it systemically. You can take prostate formulas, and these are basically, saw palmetto, the berries, which are anti-inflammatory, meaning antacids, high in flavonoids. In reality, to fix this problem, you must fix your kidneys. And what's on top of the kidneys? Your adrenal glands, and that's where your testosterones and your estrogens come from. So it is key essential to get rid of prostatitis or any prostate cancer. You have to get rid of the acids that's causing it. It's that simple. And to do that is to get the kidneys working. So to do that is you get on these detox programs. Use the kidney formulas. Use two of them. One a capsule and one tincture. Same thing with the lymphatics. Look at what we've been talking about. Get into the bowels and clean them up. You can take a prostate formula. But for you men with prostatitis, I wouldn't be taking, and we just did one on testosterone, and why do not do testosterone, even if you're low in it. Stay away from these acids for a while until you can heal these tissues up. And you only can heal these tissues up when you remove the acids that's burning them. And that's a kidney experience. And so it's always kidneys, and the adrenal glands on top. Fix all those, and you won't have prostate problems anymore, no matter how that fixes itself. Premature ejaculation, all these things that a person has can be fixed by making yourself healthy. Think holistic. Make my body healthy. Not just my prostate gland, because it's impossible. It's impossible to go in and make one gland healthy and no one else healthy. Your body works together as a team. My husband is 58 years old, has been diagnosed with prostate cancer, PSAs of 9.52. Well, that's not bad. I mean, at 58 years old, it's high. If you were about 80 or 90 years old, you might hold that number and not have cancer, but, when you're in the 50s, yeah. I had a 45-year-old male in here, and I've said this before, cancer is one in every, I was reading a thing, this is about 10, 15 years old, was saying it was one in every 3. But I had a man in one day, and this is about 10 years ago, and I was saying, cancer is about one in every 4. Or one in every 3, and this guy said, well, listen, I have 5 brothers and 4 of us have cancer. So you have to understand, understanding cancer is just simply understanding what you know about acids in the body and how it works. Just because they stamp a disease and everything so they can treat it and make all this money and get research, all that crap is what it is. Understanding the truth is vital, first of all. And so, understanding this, the PSA 9.52. Jensen had a PSA of 1,300, and another gentleman I know in the jelly field had a PSA of 2,700. When you start climbing, but I used to speak a lot to the man-to-man groups, and these are the American Cancer Society prostate cancer groups. And there was a gentleman who had PSAs of 25, and they punched him several times through the years and never found any cancer. So these are stronger tissues, it just shows high inflammation, but the kidneys are the thing. So, what causes prostate cancer? The failure of the kidneys to filter, correct? So, wait a minute, if the kidneys fail to filter, and they control the lymph system, the filtration of the lymph system, that means then this lymph system is all through the body. This means then that your lymph system's backed up all through you. That's exactly what it means. And I tell you, when you're diagnosed from an allopath that you have cancer in an area, you want to know immediately that your lymph is backed up to the point that it's breaking down those tissues within that respective area, whether it's the prostate, whether it's the lungs, whether it's the liver, doesn't matter. So I take it it's the right kidney that's not filtering in you. And you might check the right testicle and everything else, but if the liver's involved, my guess the right kidney's involved as well. They're not filtering. So that means everything on the right side, but even the left can be involved as well, is up for grabs. So you see this is the lymph backed up in the liver. Of course, that's acids backed up in the liver, causing nothing else there to back up. See, that's the point. There's nothing else there. You have blood and lymph. The blood must maintain its 7.4 pH or death is within a few minutes, so whatever the body has to do to maintain that pH. So think about this. Everybody loves their dead animal foods, but where's the pH of dead animal foods? Very acidic, right? And then we like our Coca-Colas and stuff, so now we're dumping in even more 3 pHs. And so you got all these acids dumping in, plus, plus all the acids created from the cells themselves with several pounds of those every day. But at least the blood gets an immediate hit from what you eat. So when someone says paleo diet, meat's good, think about what meat does to blood chemistry. Just eating a piece of meat creates severe negative in blood chemistry. So what does the blood have to do to bring itself back into balance? If you're not consuming electrolytes, or you eat foods that are electrolyte rich, but you cooked them and everything started bonding, now what do you got? So what you've got is a lot of acids and not a lot of bases. And so when acids dominate, then you see acidosis, inflammation, the destruction and deterioration, because acids are corrosive. And it's coming from the cells themselves. But initially the diet has been the big deal. That has reached and grabbed and destroyed the bowels, the kidneys. Omnivores are very, very delicate about too much protein. You cannot feed your dog too much protein or you get rectal bleeding and everything else from them. This whole protein myth has to be buried because protein is the problem. Let me see. My husband has always been healthy, not gotten any influences or anything for the past 40 years. It doesn't have to be. You can be a raw foodist and get cancer. I mean, let's use their name. I don't know. It's so hard when they're so dominant in using these names out there. Always know that when we use a medical name, I'm using it in disgust because this is just a fictitious name given a set of symptoms. We're more concerned with what's causing them these symptoms, and the medical doctors don't own that. They own the world diseases. Let them have it, because it'll implode their whole science. No such thing. Cause and effect. Chemistry and physics rules the world. Period. Everything has a cause and it has an effect. Everything. Everything. And nothing comes in for happenstance. Things are your bad luck. No such thing. My husband has always been, healthy, but for the last few years he has been better. Has been problems with his back for years. Well, okay, so here we go. When you start having problems with your back, and which part of the back? Lower back, right? Lower back. Now you're getting into the kidneys, the bladder, the prostate, the ovaries, the uterus. All that lower spine area is all related to those lower areas of the body. So you're going to have trouble with those areas. When you have trouble, he's going to have trouble with the lower spine with the prostatitis and prostate cancer. He's going to have trouble with the lower spine, L4, L5 with the kidneys. So he's going to have trouble with that. And that's the first warning sign, is you're having trouble with the lower back. There's not enough awareness about kidneys and checking urine filtrations and stuff yet. He doesn't take any medicines. In September last year, he started to notice that he did not have the same power when peeing as before. He did not think a lot about it. All right, so we're going on down here. Approximately 10 days later, he got a new blood test, and that showed elevated PSA. So they did an ultrasound on his prostate, gallbladder, lungs, kidneys, and liver. At this point, the immense in the blood looked good. Potassium was fine, but the gallbladder had a big stone, and they found something they could not explain in his kidneys. Ooh, I wonder, and lungs. But they did not suspect cancer. But worst of all, they found out that he had a prostate cancer, and they said they had 3 kinds of OG prostate cancer, and what he has is the worst. Well, let me give you some good news. I don't care if it's the worst or whatever for them. It's all bad for them, but not for your hubby. Now, your hubby's got to get on an all-fruit, berry, and melon diet. Get on the herbs. Start getting in those kidneys and get him filtering. Your prostate's real close to the kidneys, so you can really get that taken care of fairly quick if you get the kidneys filtering fairly quick. So you really want to get in on this and get your hubby detoxing right now. Don't wait. I know the trouble is that some of these are a little older. I have to admit that we got scared, and maybe I got more scared than my husband. That's understandable. The woman always is the love of the world. The doctors want him to have the regular treatment with radiation and medicines. But he does not want to do that. No kidding. I mean, you got to go to that, Google the CBS special on prostate cancer. I think you'll have another opinion because, again, we tried to show you some opinions. If you do nothing, you'll live a lot longer. But, you know, this is so much crap. People think about immediately when they're diagnosed with cancer, death. And that's only because of most people die from the treatment of cancer as opposed to the cancer guys. Remember I read you that from the chemist and the medical doctor that did a lot of studies way back? But this has just been proved study after study. CBS proved it in their special, if you do nothing. So don't freak out. Now, he changed his diet, eliminating all milk, sugar, and most meats. Eliminate all that now. You know what? Nothing. I don't know how much experience people have, but nothing is worth, in other words, changing your diet to a fruit diet for a few months is no big deal compared to what you are going to go through allopathically treating this. Let me tell you, it's so much easier to go on a 20-day grape fast than it is to go have your prostate removed or have the seeds or have radiation, which then fries your spine, your lower back, and everything else. Right? This lady really loves her husband. She even sent me some pictures. I love a woman like that. But he has made up his mind and wants to cure himself. I love your husband too. Ha! We went to the doctor last week. He was not very optimistic. And well, what kind of optimism would he have? You know, medical doctors can't cure anything. So what kind of optimism would you expect from him? None. And you're not going to get any because there is none. You power yourself up, just like your husband wants to do. Power himself up. Because if you do nothing, you'll have your husband longer. Remember earlier discovery, earlier treatment, earlier death. I mean, these are facts not echoed from me. These are facts by, remember the head of the Chemical Society of America? I mean, he's a pretty smart fella. Medical doctors have said this. Let me see here. Let me see. He has recovered, but is now offering my husband a hormone treatment that he says slows down cancer growth and then laser treatment in 3 months. What they want to do is something like Lupron. Now, Lupron is a testosterone inhibitor, but inhibiting the adrenal glands, never do you want to inhibit the adrenal glands. Now listen to this. So why would you inhibit testosterone, or in females, Arumadex, tamoxifen, which are actually cancer-causing by the World Health Organization, cancer-causing pharmaceuticals, but they give them to suppress estrogen. So why? Why suppress estrogen or testosterone in cancer? Oh, they're steroids, right? Not hormones, they're steroids, but why? Because they're acidic steroids, right? I mean, I don't see where they ever awake out of this nightmare of all these years of dealing with cancers, how the medical community, why these lymphologists are so much smarter medical doctors. My husband is considering it, but is not very positive about it. And I don't blame him, honey, because what you do to Mr. Mr. Prostate affects your life for the rest of your life, honey, and you can fix this and have a good life the rest of your life. You got to fix it one way or another, or you'll lose him one way or another. You can't throw your husband into the 6% oncology success rate in 5 years. Now, you can go and have him tout your first year. I have been searching advices for different people, and that is how I heard from you. I have been watching your videos, and it affects my opinion, but I am still in doubt. Don't be. We've had so many people. I mean, prostate cancer, these are what the medical doctors call that. That's been fairly easy for us. I don't use the word easy in that way, but I don't know too many men that have succumbed to that under our care. That's for sure. Hi, I have prostate cancer, which has spread to the pelvic area and spine, which can be done. Thank you, Mike. Mike, that's quick. That's quick for someone with such a problem, Mike. All right, Mike. I wake up to that. First of all, I'm on all fruits, berries, and melons, period. Don't even give me a salad. I'm on all fruits, berries, and melons, period. I'm also taking off on these kits. Or let me get you a protocol, but they're gonna follow real close with the kits. What you want to focus on is the kidneys. The kidneys control the lymph system of the prostate, but also it's all through your spine and everything. Doesn't mean you're done, but it means you got to get your butt in gear and focus. You want to pee in jars? Take a look at your urine. Get your urine filtering. And I'll use that we're not treating cancer, we're treating acidosis of the prostate that's breaking down the cells of the prostate. Cancer is a word medical doctors like to chew on for some reason. It's an illusion. You're getting chewed on by your own acids, and it's not spreading. Cells aren't moving out of the prostate and then creating a spinal or hip cancer. That's crazy. This is a systemic problem in you, Mike. It's just what we've been talking about, and you got to really go after your lymph system, and I wouldn't mess around. Not if it's already metastasized. You didn't give me a PSA here to give me some idea where you're at in that level, but when you have it in the pelvic area and in the lower back, you're up there. And it's time you've got to really put the pedal to the metal. The diet's a radical change, but you ain't got nothing. They can't do a thing for you now because it's in the hip and the pelvic area. Any radiation or anything else will just make it spread even faster because it's burning more cells, and you're already burning up there. So you want to turn this around, get your kidneys filtering, get your adrenals up to get your steroids up. You want to get those kidneys filtering. The prostate is real close there to help pull that out quicker. I'm on 2 kidneys, 2 lymphatics for sure. I'm down that road. I want to clean up your bowels because the kidneys, bladder, bowels all connected right there. So you want to clean up your GI tract and really go after this. You might check your parathyroid and take a bones formula to boot. But this is a big lymphatic problem, and you want to tackle this ASAP. Could you talk about the relationships between the adrenals, the prostate, and the hormones? There's a connection between testosterone and prostate cancer, but it's not clear to me. Standard treatment is to use various drugs for testosterone deprivation. Well, that's Lupron, but they give women same type of things for estrogen. If you've covered this before, maybe some updates. Yeah, I've covered it before, but really take a look at this. In the final analysis, the adrenals are where you see your testosterones and your estrogens. And so you know that these steroids are acidic steroids. Remember, all of chemistry can simply be divided into base or acids. Very, very few things are totally neutral. Some things are a little alkaline or a little acidic or a lot acidic and a lot of alkaline. There's all levels, just like there's all levels of people. So there's all levels of chemistry. But these acids, I don't know what the pH of estrogen or testosterone is. Anybody knows out there, let me know, because I have no clue. I've never measured the pH of these 2 steroids, but they are acidic. I don't think they're at 3 like your cell acids, like phosphoric, carbonic acids, things like this. I think uric acid is probably 2.5 the way it hurts, or at least 2.75, up there near Gatorade, which is interesting. You want to take a look at that. The adrenals, of course, produces the testosterone. So if you're a male and you have weak kidneys and adrenals and you run low testosterone, when you run low testosterone, you don't feel like you have that male thing, then you know it's weak adrenals. Well, The problem with weak adrenals is it then shuts down kidney filtration. Well, things that are close to the kidneys you're going to feel first. Lower back, prostate, things like this. As you see, the lymph is systemic, but you notice that initially it backs up more local. So for a male, prostatitis, female, ovarian cysts, uterine fibroids, endometriosis. Prostatitis goes to prostate cancer, and of course, then the females go into cervical cancer, ovarian cancer, or uterine cancer, blah, 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 because simply these aren't diseases, simply that acids are finally taking its toll on the cells. Till then, it's just inflammation and itis. Inflammation. Inflammation is acidosis. And if we use the proper nomenclature, then we know what we're talking about. And so, acidosis. So when your kidneys aren't filtering, you're going to see some prostatitis, no matter how small. If you're at 1, that's hot enough. And so, PSA that is. So, if you're running high testosterone and you're not filtering, your prostate is going to go, your PSAs are going to go soaring, because that's acid on top of acid. Now wait a minute. If medical doctors know that you're going to use Lupron to suppress testosterone because it's acidic, and that we don't put acid on top of acid because that explodes things, why do we give chemotherapy? When you find that out, let me know. So, if you've got prostate cancer or prostatitis, you've got to fix what? The kidneys and adrenal glands. Absolutely. If you run low testosterone, that's kind of good. I hate to say this to you guys, but if you run low testosterone, and of course most of us have kidney and adrenal weaknesses, fix that first. Clean the prostate so when your testosterone levels go up, you're not going to overburn anything, because you remove that acidosis out of the prostate, and then you're good. So for some people that have lower PSAs, I'm happy to see that when they have lymphatic problems, because with high testosterone levels, wham, and look at what medical doctors do. You have low testosterone, here, take some testosterone. Now, I probably could learn that by the time I'm in the 7th grade. I'm just saying. That is the worst thing you can do. You don't give testosterone and low testosterone, because that's the adrenals. Of course, you know you're not going to produce your own testosterone. Plus, if they have prostatitis and you're in a PSA and you go, oh, that's not bad, 1's not bad, you could send that person right on up into prostate cancer. But they don't think like we do, because we overview, we're thorough in the way we look, we're on point the way we look, and we're factual and scientific the way we look. Important to remember that. This isn't just, we're not talking about frivolous things here. We're talking about what is reality and what works and what doesn't work on people's wellness. I got a new male reproductive coming out. You won't have to worry about that, but our new one now, you want PSAs below 1. You really do. Really? 1 shows a lot of inflammation, and these guys have the audacity to increase it from 0 to 3 to 0 to 4 instead of from 0 to 3 to 0 to 2. They went up the wrong way with the stats. So you want it below 1, dear. The stats on healthy raw foodists are going to be somewhat different than not. And medical has to get with that, because most of these stats are based upon unhealthy people. And you see that, what I see it when they play with the stats. And a good example was PSAs. PSAs are prostate, and they used to be 0 to 3, and now they moved it to 0 to 4. Wouldn't you go the other way? Why wouldn't you go the other way? If you had any clue to what's going on in health with people, you wouldn't go up, you'd be going down, because more people are having prostate cancer, more males, of course, are having prostate cancer much earlier and a much lower number. And a good example is I've had a 45-year-old male in here, prostate cancer, PSAs of 2. So it shows you that we're seeing weaker prostates, and therefore cells can convert earlier than later. Some of these old guys that have real strong cells, they can take PSAs up to 20. I've seen a man at the American Cancer Society, PSAs of 20, had it for 20 years and couldn't find any cancer cells. That's pretty good, extremely rare. You're going to see cancer at 10 probably. What are the top herbs for male enhancement and raising testosterone, lowering estrogen in men? You know, if I was to stop there and say, you know what, if the truth be known, make tissue healthy. That's all you got to do is make cells healthy. Well, that means you have to have a healthy kitchen and you have to have a healthy sewer system. That's exactly what that means. And then the pathway finds its own. Now that's a simplistic approach. When you want to know what herbs are good for that, I like Damiana. I mean, Damiana is definitely one that's not overly aggressive, because here's the problem. Remember, if you have prostatitis or you have prostate cancer, anything like that where you suspect any of that, you do not want to use male enhancement herbs, and you're going to have male enhancement problems when you have inflammation or acidosis building up in the prostate and testicles. You're going to have this problem. And of course, with that always is what weakness? The adrenal glands, where the final testosterone takes place, right? So, and estrogen. So making these tissues healthy is key always to the balancing of steroids or hormones or neurotransmitters, as far as that's concerned. Right? But I've used Yohimbe before. These are hot. When you start getting into some of these herbs for the prostate and for males, they're hot. And that's the issue. When you're already highly acidic, you're hot. You can feel cold, but be hot. You know what I'm saying? Some of you get that. And that's those with the low thyroids. It's burning inside from acidosis. You're cold, but you're hot. I am careful with the hot herbs, like the yohimbes and things. Really kind of cautious with some of those, even the Panaxes, when you have inflammation or prostatitis. Better to get the kidneys to filter, get the adrenals up, that'll clean the prostate. So that's all I can say is I'd make my adrenal glands healthy. By making the adrenals and kidneys healthy and filtration, you're going to clean up the testicles and you're going to clean up the prostate. So then you'll have healthy levels of testosterone. Here's another thing, guys, though. When you're on a high fruit diet, it's not really gonadal. You know, I've always said, if you want to have good lovemaking, eat a piece of meat. You know, I mean, that sounds insane, but vibrational issues. When you're etheric, you want to bond in another way. So it's interesting, you know, and I don't really mean to go out and get pieces of meat, but I'm just saying that you tend to, as you get healthier, work from here instead of the body. And I've always said that you should never know you're carrying around a human body. You should never know that. If the human body is healthy, you'll not know you have one. You only know you have one when you have obstructions in the human body, where you're getting resistance to the flow of energy. And of course, that generally is more protein acids, which then is inflammatory. So then associated pain and all that implies comes out of that. And really, when the healthier you are, you're working from up here. It's just a natural thing. Because the more energy you have, the more consciousness you have, the more awareness.